Hi, my name is Leon Latchman. I'm a 26-year-old. I'm from Guyana. Recently moved here in 2003 and I've been in Florida all my life. Um, I have two older sisters. They're actually in the nursing program, and my parents are also in the medical field. So I've kind of always been gravitated towards the medical field. So I've always had some type of interest in it, seeing that my whole family is a part of it. What I like to do in my free time, I like to go to the gym. I do work a lot, and I like to go to the beach. I like to just travel and gain new experiences. That's all about life for me. It's just gaining experience. I like to be outdoors. And the main reason I want to be a respiratory therapist is I was in nursing school once, and the respiratory system really resonated with me. The way everything worked, all the different types of diseases, all the different kinds of treatments, the pharmacology behind everything. It just always had an interest. And how I knew I had an interest is because the information stuck in my mind really well. And I just want to be able to help people, My mother was also in a respiratory therapy program. So while she was in the same program I'm applying for, I was looking at everything, and it had a really big interest. And she was explaining a lot of different things. I also did work in the hospital, and I talked to some RTs, and it just really resonated with me, and it fit the type of person that I would like to become, especially as a healthcare professional. The three qualities that I feel make me good. First one is hardworking / being driven. When I have a goal, I like to be able to try to accomplish it. I like to think of a plan. And once I think of that plan, I like to lay out every little thing that's needed to be able to hit the next level of that plan. And being an RT is one of them. I definitely do want to be in the medical field. And I definitely want to upgrade my skills and keep going back to school, and then hopefully one day have my master's as a RT. Another quality I feel like that is good is I'm very studious. I like to always, when I learn something, I like to learn inside and out. They say, if you can't teach it if you can teach something to a 6-year-old and they understand it, that means you've mastered it. And the type of field that I'm going into and helping people, especially in healthcare, I have to know what I'm talking about, and I have to know what I'm doing. So being very studious will allow me to do so, not only pass school, but be able to retain the information and apply it into the real world once I start working. And the last quality I would say is I'm very caring, and I'm really good when it comes to teamwork. I know in the program I'm going to have other individuals in my class that are going to be doing the same thing I'm doing. And I feel like if we can work together and be able to help each other study, help each other understand the concepts, some of us are going to have strengths while others might have those weaknesses, but then vice versa, so that we can work together and be able to make sure we all pass and learn the information and become successful, reliant, and smart respiratory therapists that patients can count on. Professionally can mean a lot of many things, but the main thing is being reliant, reliable to your team, to be honest, to be truthful, to have integrity, to be caring towards your patients, to be able to advocate for your patients and offer the best treatment possible, to be ethical, to be able to know what you're doing, and just to be able to be the best person you can, so your team can rely on you, your patients can rely on you, and at the end of the day that you know that you've made an impact to the world. The most thing I'm excited about learning about the program are the different diseases, how the respiratory system works, and what treatments there are. As a RT, how are we able to help our patients breathe? How are we able to save the day? That's the main thing I want to learn, is to learn valuable skills that will not only help patients, but honestly anyone around me that's having breathing problems. Thank you.